The coronavirus reality check. Stephanie Ramos took a deep dive at the office, looking at everything from door handles to elevators, even the kitchen sink, for clues on where the virus lingers and how it spreads. Hey, Stephanie.
Hey there, George. Well, doctors say some germs, like the ones that cause the common cold, can live on surfaces from hours to even days. Now, the everyday preventative measure we can take is washing our hands regularly. We've heard this, but especially if you're coming into contact with germ hotspots, which is likely happening more often than you think. As coronavirus fears spread across the country, many are wondering how to best avoid getting sick at work. We invited Dr. Syra Madad, the Senior Director of New York City Health and Hospitals Special Pathogens Program, to our offices in New York City to learn about where germs may be lurking. And it starts with you.
If your hands are dirty, you're constantly touching your face. So in a typical time period, for example, 1 hour, people touch their face at least 20 times in 1 hour. That's a lot, up to 500 times in a day.
And if your germy hands touch your eyes or mouth, you could get sick. Watch this. In this GMA business meeting, the worst offender touched his face 44 times in 25 minutes. And germs can really move. A cough or sneeze can create a viral cloud that extends about 6 feet, according to the CDC.
With the coronavirus disease, a person that's infected with coronavirus, if they cough, if they sneeze, those droplets can become airborne.
The most germs are found on places where a lot of people touch, but that may not be regularly cleaned, like the elevator button. This is another area that gets a lot of attention, a lot of people pushing the buttons. What do you do if you're trying to stay germ-free?
Sure. So again, another high-touch area right here. So in terms of, using these buttons, if you're going to use them, again, washing your hands often. That's another obviously key thing.
There's also a correct way to disinfect, and it's not by using the same wipe over and over again.
So we want to make sure when we are cleaning and disinfecting that we're getting into all of these crevices and making sure that we're doing a thorough job in terms of disinfecting a number of these things.
And the office kitchen, even yours at home, is ripe with germs on high-touch surfaces. Refrigerator and microwave handles, sink handles, and for our staff, the spigot on the water purifier. Talk a little bit about the concern with that water bottle top touching that surface.
So ideally, you obviously want to have a gap, and that way it's not touching where the water is dispensing. And if in this case, since it is obviously touching where the water is dispensing, then the germs that are obviously on that water bottle, that you're drinking out of, can then obviously cross-contaminate here. Doctors say it boils down to basic infection control. For instance, if you're greeting someone and you shake their hand, you don't really know what germs may be on that person's hand, so it may just be best to wave from a distance, guys.
Okay, Stephanie, thanks very much. Dr. Jen Ashton has been saying that for a couple of weeks right now, so we all know about washing hands. We just saw those tips that Stephanie outlined as well. What are the most important things people should be thinking about?
Well, I think this is really common sense, George. It's not histrionic. It's not reactionary. We should be doing this anyway, especially in the middle of flu season. But, in a business setting, in a social setting, again, it's just ingrained in us. We're just so conditioned to shake hands, hug, or kiss each other. We need to kind of back off that. It just is something that has low risk and likely to have some benefit. So you've seen us here doing it, the elbow bump. There's going to be a whole lot of creative and sometimes a little funny kind of maneuvers to do things that are not shaking hands, hugging, and kissing.
We've seen all these empty store shelves, sanitizer, run on sanitizer.
Yeah.
What are the kinds of things that people need to be having?
People can go to ready.gov. There's a long and thorough preparedness list. This list, George, has been out for over a decade. We saw it needed after things like Hurricane Sandy. So this is not just for coronavirus preparedness. This is stuff that most people should have in their home or apartment. And it's not just for you. We have to remember, it's not a selfish thing to prepare like this. It actually does what we call flatten the curve of spread, which means it slows it down and it protects your community. So it's really one of the most selfless things you can do to look at that list and prepare.
It's an important reminder for me. I was teasing my wife yesterday, who had done some major stocking up at home, but how should people be prepared?
Well, I think Allie's smart. We don't need to reemphasize that. No, you're right, Allie. I think that getting the things on that list are a good idea. And by the way, it's not just medical things. It's things that if you needed or wanted to stay in your home environment for a 2-week period, that you would need shampoo, toilet paper, things like that. And I think the psychological aspect of this is really important. People are nervous. Taking these steps can make you feel like you have some control over this situation.
Have we learned things from the past outbreaks that inform us on how we should have?
Absolutely, and Dr. Fauci is the expert on that, so we're seeing a lot of that implemented now.
Well, that's good, so we know.
Yeah, exactly.
Jen.
You bet.
All right, thanks, Jen.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here, so go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.